Welcome, everyone. My name is Charlene Margot, and I am co-founder of nonprofit The Parent Venture that brings you this program, the Parent Education Series, now in its 18th year. We are absolutely delighted to actually have back with us Dr. Jess Shatkin, who's going to be talking with you all about his book, Born to be Wild, Why Teens Take Risks and How We Can Help Keep Them Safe. Other than having the very best title and cover, I think you're going to find that Dr. Shatkin has some really important and influential information for you tonight about why teens do take risks. Please join me, everyone, for a really warm virtual welcome for Dr. Jess Shatkin. Thank you, Dr. Shatkin.
Thank you, Charlene. It's a lovely introduction. I very much appreciate it. I'm going to share my screen. You're very kind to have me back, and I'm excited to be with you. And I'm going to be giving you a talk that is based on the book, as you described. I will go through the talk reasonably at a good clip, but if you have any questions, if anything comes up that doesn't make sense, please ask questions afterwards. And if you want more information, you can find it all in that book. That's the book right there, Born to be Wild. And everything I say is pulled from the book and some other clinical spice that I will throw in. These are my disclosures. That's the third edition of my textbook, but it's a readable textbook, I like to think. So it's something that you may find useful if you are seeing kids clinically, or if you're a parent who's interested in learning more about how kids deal with ADHD or depression or psychosis or drug use or anything like that. It's filled with information there. And the radio show that I've been doing, I do now just an hour on Thursdays, 3 to 4 Eastern. So I guess that would be noon for you, but it's a call-in radio show. It's only phone calls and emails, and I really enjoy doing it. Feels like a good educational effort. It's at Thursdays from the NYU Hospital on Sirius XM. All right, so this is what we're going to talk about, and I'm going to spend about 20 minutes going over the first 4 points. And then I'll spend about 20 minutes going over the last point, which is the practical thing for you about what you can do. But I will be speaking first about what risks adolescents take. We pretty much know what those are, but I'll just go through the numbers with you. How adolescents assess risk, how they think about risk, which may be counterintuitive for many of you. Why adolescents engage in risky behavior, how they make decisions involving risk, and all of that helps form a foundation so that we can then think about what practices we can engage in as clinicians, as parents, as teachers, as program developers, whoever you are in this audience. If you're working with kids, adolescents in particular, or around pubertal age and up, you'll find, I think, a lot of what is discussed here to be relevant to you. So what risks do adolescents take? All you got to do is think about your own experience. What risks did you take as an adolescent? Whether it was, drinking and driving, whether it was unprotected sex, whether it was smoking marijuana or something else, drinking, whatever it might have been, or maybe it was nothing for you, but most kids dip into risk a little bit. It's a lot about how they learn. And what I'm going to tell you is that we are engineered to take some amount of risk. So that's coming soon. But the death and disability that we see in kids, all of it is due to these behavioral changes that start with the beginning of puberty. Yes, kids take risks when they're younger and they get hurt by accidents, but nothing like what happens once they hit puberty, when their emotions become very confusing and very big, when their thinking changes and they see the world differently, and their subsequently behavior changes as well. So what are the risks kids take? Here's just a quick overview for you. A lot of kids don't wear bicycle helmets. Surprisingly large numbers of kids don't wear motorcycle helmets when they ride a motorcycle. A lot of kids drink. In the past month, 20% of kids drove with someone who was drinking. 40% texted or emailed while driving. Many have had sex. Many have had unprotected sex. 43% didn't use a condom last time they had sex. 14% didn't use any birth control, and that's higher amongst minority populations. 1 in 14 girls gets a sexually transmitted infection. 3 in 10 get pregnant, and 53% of Latina teens in America get pregnant as teenagers. 1 in 10 teen girls is forced to have intercourse, and then there's a lot of binge drinking as well. So all of these things, and marijuana use, drug use. So all of these things are the risks that we know about, that you know about, and I suspect that's why you're here. Now, 85% of deaths amongst adolescents, and actually all the way until about 25, and the numbers aren't that different until 35, but they really settle down around mid-20s, are due to behavioral choices, you could say, things that people do by choice, not always good choices, not always thoughtful choices, and sometimes pushed into those choices, but they got into the car, they had the intercourse, they jumped off the bridge, they shot the gun or pulled the trigger, whatever it was. Not always in the right mind, not always doing the right thing, but these are the things that result in death in our kids. Accidents primarily, a lot due to motor vehicle accidents, suicide and homicide. I showed you the grid from 2013. This grid from 2013 till 2022 looked just like this, but homicide in 2023 became second place, essentially, more than suicide. But 2013 was an important year because that's the first year that suicide surpassed homicide as a cause of death among young people. And the things that kill adults rarely, honestly, kill children. About 14% of the deaths are due to the kinds of things that often kill adults, respiratory infections, heart disease, cancers, things of that nature. And it's true worldwide. There are some changes depending on the country. Developing countries tend to have high rates of congenital or may have high rates of congenital HIV. They may have respiratory infections that aren't accessible to treatment, but road injury, suicide, violence, and the kinds of things that cause disability, depression, anxiety, alcohol use are true the world over. Once you hit puberty, something really changes. Mental health has been moving to the forefront in recent years, and many of these behavioral and these emotional and cognitive changes that kids go through result in these mental illnesses that we see. Back in 1999, the Surgeon General reported that 20% of kids, by the time they hit teenage years, or by the time they at the end of their teenage years, 17 or so, will have met criteria. The DSM is our code book, criteria for a major psychiatric illness. But our best study, done a few years later, found in fact that those numbers are much higher, more than twice that. 50% of kids will meet criteria for a psychiatric illness between the ages of 13 and 18 in the US. This is data from, this data was gathered in 2005, reported in 2010. And 27%, 28% for a severe disorder, about 5% of that is substance use or addiction. So 22% non-substance use, but still major mental health. The other 25% or so is some things that are common that we wouldn't usually make a big fuss over. Easy to manage ADHD, phobias to spiders or heights. Those things can be inconvenient and a problem, and but if they're on the mild side, they're usually manageable. But the more severe stuff, the major mood disorders like depression, the major anxieties like obsessive compulsive disorder, trauma reactions, things of that nature. And we also know that 50% of all major mental illness begins by age 14. So if we're not thinking about kids in terms of mental health, we're missing the boat. 75% of major mental illness begins by age 24. So we really do have to think very carefully and closely about these issues early in life, because when they happen once, they're more likely to happen again. And the earlier they happen, usually the more virulent or strong they are. Adverse childhood experiences, all sorts of traumas are very common amongst kids. 60% or more, 64% of kids experience at least one of these things. And in this setting today, and this isn't just because of COVID, this was happening and building for many years before COVID, almost half of kids report that for 2 weeks they felt sad or hopeless, which is one of the core criteria for depression. 18% reported that they seriously considered attempting suicide. That's 2 to 1 females to male, and almost 9%, about 8.5% attempted suicide. So this is really frightening when you think about almost 10% of our kids trying to end their own life. And crimes happen when there are lots of youths around. So you can see that violent crimes and people who go to jail, most people who end up spending a lot of time in jail committed their crime before the age of 30. Half of all serious crimes are committed between 10 and 17. And when you have a bump in population of children and then therefore adolescents, as we did in the mid-90s, you can see right here, my mouse is moving, we saw an increase in crime. Crime follows adolescence often. All right, and youth criminal behavior happens in groups, and we'll talk about why that matters in a moment. So this is me at 16, and I'm sitting on a wall a few hundred feet above a really just a drop. It's a castle wall. I'm in Germany. I had never been on a plane. I'd never taken a trip, and I saved my money, and I went away the summer of my junior year to live with a family in Frankfurt to study German. And this was a picture they took me. I'm kind of mugging for the camera with a couple of bottles of beer, but these are the kind of things that kids do. And although I wasn't drunk, because I did have a beer. I don't think I had 2, but maybe I did. But it wasn't enough to make me topple over the wall. But even sitting on that wall, and having those beers in hand and posing for the camera. That kind of foolishness is very common amongst kids. And I was a pretty good kid. I took some risks. You'll read about them in the book if you read the book. But I also was a good student. I wasn't a good student until maybe my sophomore year of high school when I started studying, but then that righted me, and that really was protective for me. My son took this picture at age 19. He had never seen the picture before, by the way, but this is up in New York State. We live in the city. We go upstate all the time, and this is over the Hudson River, and that is a scary spot where he's at in the snow, sitting there with his t-shirt. And there is a drop of about 30 or 40 feet there, which then topples down all the way another 500 feet or so to the river, the Hudson River. So, and he shared this with me with such pride. The apple doesn't fall from the tree. He was posturing for the camera. There's all sorts of reasons we do this, but we all take risks. Now, one of the questions we often have is how adolescents do think about risk. Why is it that they would do something stupid like this or this? What is going on? And worse than that, why would we drive drunk? Why would we, text while driving? Okay. So most of us have been taught to think that adolescents believe they are invincible. And the first chapter of the book is called Not Invincible, because in fact, adolescents don't think they're invincible. We used to think they thought that they were invincible until we started studying them. And then we found out that they always overestimate risk. They overestimate low probability events like earthquakes and hurricanes, which happen infrequently. They overestimate high probability events like accidents and pregnancy. Teens believe that they are thousands of times more likely to get a sexually transmitted infection than they are actually going to get. And adolescents even believe that their chance of dying is much greater, over 200 times greater amongst 15 and 16-year-olds in the United States, higher amongst poor populations and marginalized populations. But still, kids really think that they are at risk. And I think that they think they are at risk because we've been telling them they're at risk. And God bless them, they're listening to us. But that's not the whole story, because they take risks anyway. The paradox or the irony of risk programming is that most of it focuses on telling them they're at risk. You're at risk, you're at risk, don't you see? And they actually, believe they're at risk because we have overcome their ideas about invincibility, if they ever had any in the first place. We've tried to push and tell them they're at risk. We think in terms of, risk when we measure and make decisions. And so we push them to think like us. And there's a lot of faulty thinking in this assessment. But essentially, we try to tell them they're not invincible, because that's what we think will make a difference. But this is misguided. It doesn't work. It results in programs like DARE and Scared Straight and zero tolerance policies. Even how we often teach health education and driver's education often don't work because we try to scare the bejesus out of people. Now, there is something about invincibility, but it's not exactly as you might think. So this is a comic from the Lake Wobegon series of Garrison Keillor, which is a radio show years ago. But he had this phrase about his town, this fictional town, that all the women are strong, all the men are good looking, and all the children are above average. And that is called a self-assessment bias, that we have this bias that we think our marriages are going to survive, even though almost 50% end in divorce and about 65% of second marriages end in divorce. We think that we're going to beat the odds when it comes to death, even though men die on average in the United States at about 76 and women at about 81. And if you're a professor like me, 95% of professors believe that their work is above average. Impossible, right? Now that's self-assessment bias, sometimes called the Lake Wobegon effect. But optimistic bias is something different. Optimistic bias is the idea that even though I face risks, and even though I believe the risks are very, very high, because I don't believe I'm invincible, I have something called pluralistic ignorance. That is, I think something that other people don't think. I know how to protect myself and other people don't know how. So the risks of dying are really high. The risks of getting HIV are really high. The risks of getting drunk and ending up in the emergency room are very high. So think young people. But I know what to do about it. And that kind of optimistic bias, we think, is due to this pluralistic ignorance, this idea that the plural, everybody else, doesn't know what I know. So there is, again, a different sort of assessment. And adolescents commonly do have optimistic bias, even though they don't think they're invincible. But the clincher here, and what really matters, is that adults have just as much or even more of this optimistic bias. Maybe it's because we've lived longer. Maybe it's because we've beat the risks. So we actually, or we have experience, we actually think that even though the risks are great, we know what to do about it. And we think the risks are pretty high as well, maybe not as high as kids do, but we also think that they're pretty high. So the take home point here is that then telling young people that you're at risk, don't you see, is not effective, because they already believe that they're very high at risk, but they believe, some of them, that they have a special way to get around it. So why do they really engage in risky behavior? What's really going on? If it's not a thought of invincibility, the reason they really take risks are multifold, but I'm going to go through them quickly here. One is that the brain isn't fully mature. So the emotional brain centers, what we would call the ventral striatum or limbic system, these emotional centers mature very quickly, so that by 10, 11, 12, kids can feel passion. They can feel, excitement and a sexual turn on. They can feel anger and envy. Remember your 2-year-old who said, "I hate you, mommy or daddy," and then sat in your lap 30 seconds later and said you were the best person in the world? They can hold on to it more as they hit teenage years and puberty, and they really can get brought down by it. And it takes a while for the frontal cortex to really get some influence, more influence over this ventral striatum or this emotional part of the brain. And we know that that takes about 10 or 15 years to really connect better and to control. Nature has made us this way for a reason I'll get to in a moment, but there is a difference there. Our passions mature before our cognition or our thinking or our ability to control it. Romeo and Juliet's the best example. They were 13. They fell in love after fewer than 100 words. They were willing to die for one another after knowing each other 4 days. So really a lot of passion, not a lot of thinking. Also, dopamine levels are higher than ever before. And dopamine's not exactly a reward chemical. It's more of an anticipation of a reward chemical, neurochemical, but it drives our behavior. It drives our learning so that we do things because it feels good. And so dopamine levels are higher during adolescence than any other time of life. And therefore, sex is really appealing and exciting, and trying new things seems appealing and exciting. And a roller coaster or a new flavor, all of those things are very passion filled. We also have a lot of hormonal changes going on. We have earlier puberty for all sorts of reasons that are interesting to talk about, but earlier puberty sets kids at risk longer. Some of this is driven by the light kids are exposed to, because actually high light drives down melatonin. A drop in melatonin releases a chemical called kisspeptin, which starts puberty. You can read about it in the book if you want, but the take-home point here is the more light we expose our kids to, the more puberty blockers like plastics we expose our kids to. The earlier we make puberty, the more likely it is that we are going to face longer years at risk when we're cognitively not ready for it. And then there's also other hormones like testosterone, which drives competition. And it's not so much, it makes your muscles bigger and all that stuff, but testosterone is really about competing, and testosterone levels are higher than ever before. So what are we competing for at this age? The best mate, the best mating ground, who's going to run the clan. This is the evolutionary history of humans, and we do the same thing today, competing for which group we're in, competing for quarterback, competing for the most attractive mate, all that stuff. And so we are driven to do that. Even as I talk about in the book, even kids in a Tibetan monastery who are supposed to be kind compete for who is the kindest person, who can give the most away. So this is just driven into us. And oxytocin levels, sometimes called the love hormone, the bonding hormone, are also higher than ever before. So oxytocin drives this connection to people. It helps build cliques, keep us in, keep them out. It drives a lot of competition as well. Peer effects matter, how we assess ourselves. And we are always thinking at this age about what our peers think. I'm lucky, it feels, to be not so worried about that anymore. But I think any of us can remember what it was like in adolescence to be so consumed by what others think of us and how important that was. And that drives a lot of behavior that we wouldn't otherwise engage in, because I got to be seen as the strongest, the smartest, the best looking. And so I might take a risk to support that. There's also a really efficient brain that we have, and the brain only has one set of pain receptors, because you got a 3-pound brain on a hundreds of pound body, and so the brain has to be really efficient. And the brain has one set of pain receptors that respond when we feel physical pain or emotional pain. And if we had more time, I'd ask you, what's the most painful experience in your life? And 95% of you would say something emotional, not something physical. Those things really hold on to us, and they really grab us. In fact, when someone's having a breakup, if you give them a painkiller, whether it's an opioid or even Tylenol, they will feel better. And the pain receptors in their brain will calm down. When you're upset about something, painkillers are really helpful. It's part of the reason we have an opioid crisis. So what would we do to avoid emotional pain? Just about anything. So if somebody jumps off the bridge and now they've shown that they're very audacious and they're showing off for the girls, then maybe the next guy is going to jump off the bridge. Or if one girl's having sex, maybe the other girls will start having sex, because these are the things that we don't want to feel excluded from, because it really hurts. And then there's all these behavioral contributions, school demands, when school starts, which is out of sync usually with our sleep schedule, and the kind of cigarettes and tobacco and marijuana and all that kind of stuff that we do. So all of this leads to a huge evolutionary advantage for survival. So I like to say that Mother Nature has decided that, she will sacrifice thousands to save millions. We actually need young people to take risks. If they don't take risks, we won't find the new food source. We won't find the new water source. We won't find the new clan to intermix with, because you can't mate with your family members. So we need people to take risks, and adolescents are uniquely geared to take risks. And we're not going to beat that out of them anytime soon. That's evolution. That's DNA. It's the way it is. The adolescent brain isn't an accident. We're not doing anything wrong by imagining that we presented them with risks that they've never had before. There's always been risks. Different versions of them, same basic thing. It's a perfect evolutionary design. Drugs and alcohol take, as I said, behavioral contributions, whether it's vaping or caffeine or tobacco. If you haven't tried a drug or alcohol by the age of 26, there's almost no chance you'll ever try one, just because we explore more when we're younger. So this is the evolutionary advantage. Somebody's got to, get on land. Someone's got to do something different. That's the adolescent paradox. They're healthier, they're stronger, they have better temperature control, better pain response, they're faster, all the rest of it, but they engage in a lot of risks and they die at higher rates and they get sick at much higher rates. So youth is really not wasted on the young. All right, how do adolescents make decisions involving risk? Very quickly, they basically overthink. And there's a lot to say about this, and I spend a few chapters in the book on it because it's so interesting. But essentially, anything that is new to them, they will overthink. We think that they're impulsive. We think that they don't think. Actually, when you time adolescents making decisions, they overthink. They think of all sorts of things. So our job is to give them guideposts and rules to help them. And advanced decision makers, people who have been doing something a long time, that 10,000 hours that Malcolm Gladwell talks about. Advanced decision makers don't overthink. They go right in because they've had experience. They know what to do. They know that I'm in Austin tonight. I'm at a meeting away at, I'm usually in New York City. And I could go down to the bar and I could meet a person and have an affair with them tonight, but that doesn't even cross my mind unless I'm talking to you about it, because I have a pathway that I have lived by and I know how I live now. And the likelihood of that is so low at this point in my life. When I was 25, the likelihood was much better. 30, a little bit less. 35, a little bit less. 17, all bets are off, because I haven't had the experience. But by now, I know what it means when someone has infidelity. I've either seen it or witnessed it, or my siblings had it, or maybe I had it, or my wife had it, whatever it is. We've gone through things. We've read about it in books. We've seen movies. So we learn over time. And if you study any kind of professional, physicians or resident physicians or nurses or triage people or firefighters or pilots or drivers, everybody makes risky decisions with less information. They do it based on their experience. And so us shouting at our kids about all this information about what they're doing wrong and what they should be doing doesn't really help. It's okay to tell your kid, driving drunk is dangerous. That's fine. There's a certain way to say it, and I'll tell you in a minute. But they know that already. This is not news to them. They've been told this for years. So you saying it again is less useful than you giving them guideposts to live by, because they need experience that they don't have yet. I love this quote. This is from Suzuki Roshi, who was the first Japanese monk to make it to America that I know of. He was at the in Monterey, not far from you, at the Taslahara monastery there, which he helped to found. And he has this quote, which I love: "In the beginner's mind, there are many possibilities. In the expert's mind, there are few." Meaning that the more experience you have, the easier it is to make difficult decisions. So now we're at the meat of what I really want you to walk away with, which is what will keep our adolescents safe from risk. So here's some guiding principles. Bombarding them, as I've said, with more information won't help them make better decisions. They'll know more, but it won't change their behavior. Secondly, you want to focus on practice. So they need practice, like anybody needs practice with anything to get good at it, piano, baseball, whatever. And they need to feel it's emotionally relevant to them. So some health classes and things, as I said before, and driver's ed classes, by getting kids to overthink, they get caught in the weeds and they don't have a guidepost to live by. So we really do want to narrow in on very clear rules and parameters for them. And of course, adolescents aren't fully mature, so protect them as much as you can. They got to take some chances. They have to, drive a car at some point. They have to, cross the street at some point. They have to try a new food at some point. We don't want to baby them, but we want to do this in a measured way if we can to give them opportunities. So our risk reduction efforts should focus on teaching this non-deliberative decision making. That is, don't stop and weigh the pros and cons in the moment. If you want to have a conversation about pros and cons, do it before the risk is faced. Have it at the dinner table, while you're having an ice cream cone with your child. Don't do it when, don't teach them, okay, when you're behind the car, think to yourself, now, do I drink? Do I not drink? That's not the way to go about this. Shelter kids as much as you can when they're young, give them opportunities to grow, but let them have the magic years. Let them believe in the tooth fairy as long as they can. It's good for them. And modify the environment as much as we can. Policy changed, the graduated driver's licensing that California and many states use is really fantastic because it does give us some parameters that are very effective. So those kind of, those projects are good. Apprenticeships matter. Kids don't get apprenticeships any longer, but I still remember my friends who had paper routes. These guys were up at 4:30 in the morning. They delivered newspapers, they made good money, and they worked amazing hours, and they were often good students because when you want something done, you give it to a busy person. People who are busy, they learn how to structure their time, and shielding our kids from everything but homework is not necessarily the best thing for them. Having some work, having some opportunity, giving to other people, really helpful stuff. Here's the practical stuff we can do. So authoritative parenting, which is often called right parenting, just right parenting, it's loving and kind and directive, but it's contrasted with other forms of parenting, which might be permissive or indulgent or authoritarian. I'll say more about this in a moment, but we have studied now parents who engage in this type of parenting, which again, I'll talk about more in the next few moments. But when people use this style of parenting, their kids do much better in all sorts of ways. More on that soon. How do we teach authoritative parenting? We have a wonderful behavioral treatment that was developed at UC Berkeley that has been propagated all over the world in lots of different forms, but it's called behavioral parent training, parent management training. And this approach to parenting focuses on positive reinforcement, on effective commands, on active or selective ignoring, on reward programs, so token economies. You earn your privileges. You don't just get them because you're a wonderful person. You get love because you're a person, hopefully, and support, but you don't get privileges without earning them and being ready for them. And that's an important distinction. You punish where you have to, but you save punishments because punishments are not that effective. All of our behavioral technology shows us that you get many more bees with honey than with vinegar, and that when we punish, we often punish too long, we often punish too aggressively, and kids don't learn from that. So more on that too, if you want to talk about it. Monitoring your kids really matters. So that doesn't mean putting a bug in them, and it doesn't necessarily mean monitoring their cell phone activity all the time, but being present matters. Knowing your kids' friends, knowing your kids' friends' parents, introducing yourselves, having them over for dinner, those kinds of engagements, going to their games, going to their activities. They may not want you there sometimes, and you'll have to work that out with them. But showing your interest in being present makes an enormous difference. And parents who are present in their kids' lives have kids who get a lot more support, structure, and take many fewer risks. And when we are present with our kids as well, we find that they go to us for information. And if they don't go to us, they'll go somewhere. They'll go to the internet, they'll go to some other friend, but it's best if it comes, or a lot of it, from a parent. You got to talk to your kids about sex, drugs, rock and roll. You just have to. They're going to get it everywhere else. Ignoring it doesn't mean it doesn't exist. I know these are uncomfortable conversations. Think about driving in the car. That's a good time. They're locked in. You can have the conversation then. You don't have to pin them to the wall and say, are you having sex? But you need to know that you are someone they can come to. And if they can't come to you, there's other places that you can recommend they can go to, and you can refer them to them. And there's the uncle or the aunt or somebody else who can be a part of this as well, and that you are interested, not that you're cool, you don't have to be the cool parent, you just have to be a parent who is in the know. You understand that sex is something a sexual drive they're feeling. You understand that kids around them are using drugs, whether they acknowledge it or not to you, and all the rest. General interventions that focus on substance abuse education for everyone so far have not been found to be very effective. But if we have kids we know who are at risk because of their environment they grow up in, because a parent has a substance use problem, then those kids do benefit from more education and supervision to help them not to get into drugs. So it's not something we have to talk at school with about everybody in great depth, but we do need, when we target people, we do much better. So reward, kids are really driven by reward. I mentioned that dopamine levels are higher at this time of life during adolescence and early adulthood than they ever are again. So think about the rewards kids want. And I often try to target the rewards. I remember working with a pediatric oncologist faced with a kid who was not, well, there's a kind of leukemia that you really have to take your medicine for 5 years. You get this treatment, and then if you take these pills every day for 5 years, there's a very, very good chance that it'll never come back. And a lot of kids are struggling with taking these pills. And so one of the ways to talk with young people about this is to say, well, what do you want as you age? I mean, not what do you want 20 years from now or 50 years from now? Don't you see you might die at 30? 30 to a 15-year-old is so far away. But do you ever want to get laid? Do you ever want to drive a car? Do you ever want to, these kinds of things are motivating because they're just around the corner. And so those are ways to reframe reward. What do your kids really want, and when do they want it? Think about things that are soon. Provide safe risks. So skiing, skateboarding, in reasonable ways. All those fun things, if you can afford to do them with your kids and you can take them, then those are great opportunities for them. They will get something out of it, and it will satisfy some of that drive and that excitement, and to give them something to talk about it and feel passionate about. Those are good. Sports, of course, at school can provide a lot of that as well, as can drama or art or School of Rock. Kids are doing something. These are risks to get in front of other people. These are risks to perform or to play a sport. So it doesn't have to be extreme. It can be just their clubs and activities, which can be great. Boy Scouting and camping and all that kind of thing. And again, highlight the short-term benefits of not taking risks, all right? So if you don't smoke weed, you don't have to lie to me. And that's got a benefit. It's not the only thing in their life that they care about, being truthful to their parents. And, you could argue they sometimes don't care that much about it, but most kids do. They don't want to lie to their parents. They don't want to be deceitful. And being the cool parent and saying it's okay to smoke weed is also not very good. It's not good at all. It's not even very. It's not good. Being the parent who says, marijuana is legal in California, in New York, in most states now, 38 states, and marijuana is something you may want to try one day. It's much better if you wait, because when you're younger, marijuana has a more destructive effect on your brain. Even though you may not notice it, it does. And there's lots of information about how to share that with them. But what are you trying to give them instead? What can they do instead? What's the short-term benefit? Well, they'll learn better. They'll sleep better. They'll feel actually less anxious, even though the one time they smoked weed, they felt less anxious. And so they think, oh, this is a pathway to that. So there's a lot of learning and again, supervision and support. I want to say a little bit more about authoritative parenting and how well it works. And as I said, again, in contrast to negligent, I don't even know what you're doing. Permissive, oh, you can do anything, I'm the cool parent. And authoritarian, why? Because I said so, which is not very helpful for kids either. Now, there is a place where authoritarian parenting has been shown to be equally as effective to authoritative parenting, and that is in high risk, dangerous neighborhoods where a child could get hurt walking in the park because there's drug deals going on, there's violence, there's gang activity. A parent who is very driven to get their kid inside or shepherd them can have a really good influence on their child. But generally speaking, authoritative parenting is the best. And kids who are raised with authoritative parents have all these great things. They have better grades. They're more likely to go to college. They have higher self-esteem. They're less likely to get pregnant at a young age. They're less likely to drop out of high school. They're less anxious and depressed. They report that they feel better about themselves. They have less antisocial behavior, so they don't go to jail very much. They also have slower growth of a part of the brain that is involved in emotional processing and responding to threat and agitation, called the amygdala. So this is really important because kids do better when they have a slower growth there. And their brain reward centers, the nucleus accumbens, is less demanding as well. So enhanced supervision. Well, as I said already, the more parents know about their kids' lives, the fewer risks they take. So the more parents communicate, the more they're seen as trustworthy, a really important thing, the more they seek us out for advice. And after school programs, sports, music, art, drama, really great. Curfews, super reasonable. Actually, they really work if you enforce them. That doesn't mean you got to severely punish them if they go outside the curfew, but you got to call us by a certain time. If there's drinking, you got to take an Uber or call us to pick you up. You know, these kinds of things. There's a wonderful program in Iceland, small country, not too hard to manage. But when they enforced curfews and required after-school programming for everybody, learning if they were having trouble learning, so tutorial support, sports, arts, all the rest, these kids did really well. Cigarette smoking went from the highest rate in Europe to the lowest rate in Europe within months because kids needed something to do. The fact that we go to work very early and then come home at 6 or 7 o'clock or 8 o'clock and have dinner with our kids, hopefully. And our kids get up very early and go to school and then are done by 2 or 2:30 or 3 o'clock and have 3 or 4 hours to mess around without us knowing what they're doing. Really not a good plan. It hasn't really worked very well. They're totally unsupervised, and supervision makes a big difference. Let's talk about screens. I love this little picture of the gold toilet because 7 billion people in the world. In 2013, the WHO, World Health Organization, said that of the 7 billion people in the world, only 4.5 billion people had access to a working toilet. Didn't have to be a gold Gucci toilet. It could be just a pit in the ground, but an actual place to go to the bathroom and put the waste aside. But 6 billion had access to a smartphone. That was 10 years ago. So remarkable things have happened with screens in a very short time, and really led by people out in your part of the world. Most kids have an electronic device in their bedroom. Many kids have more than one. Many kids leave a television on all night long. Screen use definitely affects the brain. We're learning. Studies are hard to do because everybody's got a screen, so you can't take a population and say, here's 1,000 people who've never had a screen, and here's 1,000 people in the same environment who've had screens. But we have been able to associate increased screen time with a bunch of things. Decrease in gray matter, that's good brain growth, not good. Reduction in the frontal lobe, the CEO of the brain's cortical thickness, also not good. Reduction in attention span, poor performance when it comes to memory and thinking. Enhanced reward desire, so more drive to get rewards, and a decreased sensitivity to loss of those rewards. So they're more engaged in throwing a gamble again and trying again in a risk. Signs of cravings that are similar to when people are very hungry or want to get a drug. Higher rates of obesity, of course, because they're sitting still. Our kids are spending hours on average. You probably know the common sense media numbers. High school kids are spending 8 hours a day on screens, not for school. And middle school kids are spending about 5 hours a day on screens, not for school. And it's higher amongst marginalized populations in the United States. So we've even seen this in little kids, in pre-K kids, in terms of literacy centers of the brain where they learn to read, that those areas of the brain have been compromised but when kids spend a lot of time on screens. So a screen isn't evil. Like everything else, it's got to be managed. I'm very Aristotelian, moderation is the rule with everything. All things in moderation, or most things. When a cell phone is present, like if we were sitting and having dinner and you had your cell phone on the table or on your lap, or I just saw your cell phone, here's mine, then I would report in a survey that you were not a very good listener, that you were not always as empathic as you could have been, that you didn't connect with me, and that I didn't necessarily trust you were listening to me. Just having a phone on the table suggests that you were distracted, even if it's face down. So think about that at dinner. Think about how often you check your phone. Think about who you're with, because your partner perceives that. Now, they may have a phone out too, and you may perceive the same thing about them. Great. So now neither of us is really paying close attention. All right. This is why God created the fruit bowl, I say. We got to put our screens in there, get the phones out of the kids' hands as much as we can. Wait until 8th is not a bad idea. This idea of postponing phones until that age, considering things like Life 360 or Find My Friends and iPhones so that you can keep track of your kids to some degree. My kids like Life 360, I think, more than I do. We put our family on it. It's free. You can pay for a version, but we pay for nothing. We get the free version, and it's great. My kids both live in Europe, so I'm able to see where they're at, and they're able to see where I'm at, and I know when they're moving around, and it's actually kind of fun. We can connect with each other. And my son texted me just before I started talking. He said, "What are you doing in Texas?" Because he's got Life 360. So, all right, postpone media use. Friend your kids. You own the phone. A privilege, not a right. It's a privilege. There's none of your kids. Maybe I'm wrong, but it would be hard to think I'm wrong about this. None of your kids need or must have a phone. Everybody around them has a phone. If they had an emergency, if they needed to contact you, they could ask a stranger, they could ask a friend, they could run into a store like we used to in the old days. There's a lot of ways we can function without phones. So don't be afraid of enforcing your ownership of that phone. Screens are a privilege. First work, then play. That's the golden rule of parenting. Think about limitations. Maybe it's only an hour a day during the week, and maybe it's a few hours on the weekends. These limitations are going to bust open, of course, by the time they hit teenage years, and they've got computers and all sorts of ways to get around you, laptops and this and that. But screens are best in the main room of the house. Keep away from a laptop and iPad as long as you can, because all those devices go in their bedrooms, and before long they're taking their clothes off on screen. I mean, I'm probably preaching to the choir, but you'd be surprised. The best of kids, the highest scoring SAT kids, are still taking a lot of these risks. So I've said that already. Supervise, doors open, stop screens before bed because of the light. And you can think about using light control devices that decrease blue light, which blocks melatonin. So you can use these devices to limit that. Other things we can do is to help our kids realize that as much as advertising looks cool, that most of the companies that are targeting them for high risk, like the Juul or vaping or even caffeine drinks or cigarettes or alcohol, are targeting them specifically and making fools of them. And kids like nothing more in adolescent years than talking back to the man. They mistakenly think that you are the man and that you are trying to manipulate them. The people who are really trying to manipulate them are the Steve Jobs of the world and the Bill Gates of the world and the Gamings of the world. Those are the people who are really manipulating them to buy more, to take more, do time on screen, and to engage in more activity that is, again, computers are great, but 8 hours a day for an adolescent for entertainment, really? That's crazy. That's time they're not exercising, time they're not sleeping, and all the rest. So let them know who the man really is. Teach them media literacy. Fight back against the man. Here are some simple advertisements. George Clooney drinking alcohol, looks cool. He makes a tequila, good for him. And then he's driving with a motorcycle without helmets on. And this is what our kids see. When you talk to kids about this, they think this is kind of cool, but it's not cool. It's foolish. Here's an advertisement for a gaming device that kids use with Heineken attached to it. Here's a nice advertisement of young adults, seemingly not so upsetting. It's a bunch of Black people having fun on a roller coaster with a Newport cigarette in the corner. And this wouldn't be offensive if it weren't for the fact that we target Black and other marginalized neighborhoods with our advertisements for cigarettes and alcohol. And there are up to 10 times more cigarette advertisements in Black neighborhoods than in white neighborhoods. And we also liberally give these to people with mental illness, and they overuse cigarettes and other products like this as well. Here's information on e-cigarette use. It's gone way up. I don't have time to go through the details, but it's just increased a great deal. This is even in 1 year, 2017 to 18, how much it went up. There has been some decrease in tobacco use, but amongst high school students, and we are seeing the first drop ever because we've been hitting this so hard, but we still have a huge problem there. And these are some Juul ads, and you can see these ads are all really targeted to young people. They're hip, they're cool, they're having a Juul. It's amazing. I'm vaporized, And this one here, this picture here with this woman is really interesting because this is a pose that Ariana Grande is very well known for. And these advertisers have no compunctions about using these sort of recognized images to copy their ads off of, to sell these things to young people, even though they're really designed for helping people quit tobacco. Hardly. All right, 15 to 17-year-olds are 16 times more likely to Juul than those 25 to 34, which is theoretically who they were created for. Here's a very phallic vodka ad. Here's a very phallic perfume ad. Here's a very sexualized jean ad. Here's a very sexualized Coca-Cola ad. Here's a remarkably sexualized sandwich ad or burger ad. So these things are everywhere. And helping kids see this is really very, very useful, because they'll start to see who the real demon is here. More things we can do. Acknowledge that the risk is low if you want. You can, they may say that the risk, you could ask your kid, if you go home tonight and you say, what's the risk you'll get pregnant from one-time unprotected intercourse? They'll probably tell you 95%. The real risk is about 5%. It's 25% in the 48 hours around ovulation and about 3% the rest of the month. It equates to about 5% overall. Whether they know that number or not doesn't really matter, because they're not basing their judgment on the percentage of risk. So you can acknowledge it's low, or you can go with their estimation of it being high. But the issue is, once is all it takes. That's your new phrase. It only takes once. Not don't overdo it. You're going out tonight, don't overdo it. Okay, be a good kid. Not too much. Not too much is basically saying decide on the go. And after 2 beers, how many more, can you have? Well, the number after you've had 2 is a lot easier to conjure than it is when you've never had any to begin with. So more begets more, and don't overdo it is not the message. The message is once is all it takes. So use analogies to steer kids away from these things. Would you play Russian roulette for $1 million? That's a 1 in 6 chance you're going to die. Other things we can do is to try to develop emotional and personal cues. What would you do if you got pregnant? What happens next and next and next? This is really helpful therapeutically for me when young people are taking risks, because they don't want to put themselves in that thoughtful position of what can I do? What would happen to me? But it helps to register the emotion, and the emotion often leads their behavior. So don't be afraid to say, your daughter's having pregnant, your daughter's having sex, your son's having sex. So what happens if you get pregnant, if your girlfriend gets pregnant? What happens then? Let's kick that can down the road. What happens? Tell me what's next. What's next? What's next? Well, then we better get you on birth control, or you better whatever, or you're having a conversation that matters, or you shouldn't have sex. But putting your head in the sand and thinking they're not having sex may not be realistic. Red alerts. What's a red alert? A red alert is a high risk time. So something like when child's home alone with her boyfriend, that's a red alert. Kids will have sex with you in the home, but they're more likely to happen if you're not there. So when are these times, and when should you be looking at this? And then teaching kids ways to say no, or ways to step out of things. My parents drug tested me, maybe next time. I've got a game tomorrow, I got to study for a test. Help them, if they're not ready to take risks, to come up with phrases they can use. More things we can do. You got a role model. So you may enjoy drinking, and that's fine. You can have a drink at home, that's fine. You shouldn't be getting drunk at home unless you want your kids to feel comfortable getting drunk, because they do as they see. All right, use frequent reminders, that's fine. Just remind them that you're there, remind them you're watching, remind them you're interested. Help them plan decision pathways in advance. You don't want them making deliberate decisions in the moment of risk. You want to help them plan in advance. Don't encourage risk benefit in the moment. Teach emotion regulation skills. There's all sorts of information about this, which I can't go into now given the time, but helping them to learn when they feel anxious, when they feel moody, and what to do about it is helpful. Helping them to understand that their friends are not taking as many risks as they think. Just like they overestimate the risk of bad things happening, they also overestimate the number of people doing things because they feel left out. We all feel a little bit of FOMO, fear of missing out. So they feel left out. So if you ask a young person how many of their friends are smoking marijuana that month, they'll tell you 30, 50, 70%, whatever they'll tell you, but it's going to be much higher than the actual number, which is probably more like about 5 or 10% that month. So helping them understand that is important. And then I said nobody makes a judgment based on percent, because the best of us don't do that well with percent. If you're going to use numbers, use ratios. So the likelihood of pregnancy is 5%. You want to use that? It's 1 in 20. If the kid says it's 90% chance, then you say it's 9 out of 10 times. You get that, right? 90% is not like some theory. It's 9 out of 10 times. So if you have sex, the likelihood you're going to get pregnant is really, really high. All right. And there's much more we can do. Limiting phones in schools, focusing on exercise, sleep, and nutrition, what we call the triumvirate of good health. School start times are really important because our kids take risks when they're underslept and not thinking clearly. After school programming really makes a difference. Making condoms available and teaching proper sex education, targeted drug abuse program for those who are at risk, school-based mental health clinics, good mentorship programs, teaching resilience. I'm a big advocate for a neuroscience curriculum, which gives a theoretical sort of foundation in high school, but also teaches them exactly how to identify emotions, how to use communication skills, how to organize themselves. That's the OST, organizational skills training, cognitive behavioral therapy skills around emotion and anxiety and depression and sleep, really important, and risk management. And at the big level, of society, the things we all contribute to: poverty, mentorship, policies, drug and alcohol laws, all that kind of stuff. All right, that's the book. If you're interested, it's available a million different ways. That's who I am. I thank you very much for your attention, and we got some time for discussion.
Well, thank you very much, Dr. Shatkin. That was kind of a whirlwind. I'm still back on, we only have one set of pain receptors. So when our kids have a broken heart, we need to really listen, don't we?
Yeah. And I'm sorry I went quickly, but I'm trying to give you an overview.
That's great. So much great stuff to think about. And again, so many of the things you're saying do seem a little bit counterintuitive. For example, you say that the teenage brain is born to be wild, right? Born to take risks, born to explore. I think about your story about somebody had to guard the cave, right? That was a teenage version of a cave teen.
Yeah.
Why do we, especially parents, resist the very things that make teens unique?
I think we're scared for them. I think we love them. I think that we don't want to see them make the same mistakes we made or friends of ours made who got hurt or died or had an early pregnancy and it changed their life forever. I mean, there are certain things that you just don't come back from. Now, it doesn't mean you can't right the ship again. It doesn't mean you can't have a great life and be very successful. But if you get pregnant, then it's like, do I have the baby? Do I have an abortion? I mean, that's a life decision that you will come back to many times in your life. If you get arrested, if you hurt somebody or hurt yourself, if you got hospitalized for psychiatric purposes, these things, you can work through all of these things. It may make you, in many cases, a stronger person. However, these are things that change you. And so we know that these things change people, and we want to protect the people we love. So I think that we do what's intuitive to us, which is stop, no, don't. Turn a blind eye to it because I don't want to know if they're having sex. I don't really want to know how to deal with that. So I'm not going to talk about it with them. These kinds of things.
Yeah, exactly. I do think parents get afraid of the teenage years. Yeah. Everybody, You have a 9-year-old and you're like, things are good, but oh no, what's coming, right?
Listen, my kids are 26 and 23, and I'm still afraid of them in some way. But the fear doesn't stop me from being a good parent. That's the thing. I don't want to get them angry. I don't want to have them haul off and give me a dirty look, but I'm not afraid of it. I mean, I feel it, I guess, but in the long run, I'm still willing to get in the trenches enough to deal with it because I know it's the right thing to do. None of us really like conflict, but we have to embrace it sometimes.
That's right. My oldest now has a 2-year-old. That is in itself a whole new risky thing.
Yeah.
All right. Some really great questions coming in, Dr. Shatkin. So here we go. Love this question. How much information do you share for teens and tweens? That is, what depth of data versus the anxiety inducing of giving too much information?
I think that you want to go with what you think the person wants to hear in terms of content and quantity. So if a child comes to you or your adolescent is talking about something, you might start by asking what they know about it. And what do they want to know about it? You don't have to be an encyclopedia. You don't have to do what I do. I teach courses on these things, but even the parents and the kids, they don't need to know all this information. You need to mostly know what to do. If you want to know why and where it comes from, read the book. But mostly what you need to do is to have some parameters you can live by. So I don't go around saying, do you know the risk of pregnancy is? Because I know it doesn't matter if they think it's 1% or 100%. That number doesn't matter to them. What matters is that they have access to birth control, that they know that they can come to me, that they know how babies are made, and that they know that there is a real risk. It only takes just once to get pregnant. And if you get pregnant, that is going to change your life. Also, pregnancy or having sex comes with a whole bunch of emotional changes. Are you sure you're ready for that? So again, these are conversations to have with our kids. And there's a huge range. Some kids are ready to have sex at 15. Some kids are ready to have sex at 25. And it depends on the kid. It depends on the culture, the environment, who they're with, all those kinds of things.
Well, I love your advice that it is going to be uncomfortable, and that's okay. And you don't have to be cool. You just have to say it. You can even say to a kid, right, I know this is kind of uncomfortable, but
Totally.
What do you know about having sex, right?
Yeah. You can tell them exactly what you're doing. One of our parenting techniques is selective ignoring. I'm going to ignore uh, when you keep saying, "When are we getting to grandma's house?" I've told you now it's going to be, 15 minutes or whatever. I'm not going to answer if you ask that question again. And I've told my kid my strategy. I've told him the strategy, but now I'm going to do it. It's fine to tell him your strategy. Just
See?
do it.
Absolutely. Mine are now like, we're on to you, mom, but we're still listening. So, okay, here's another great question. I know we have just a few minutes together. How does ADHD or other types of neurodivergent affect the trends you mentioned and then the strategies parents need to use?
So ADHD is a good example. Attention deficit hyperactivity disorder increases the risk of just about everything when it comes to behavioral challenges in adolescence. It increases the risk of driving accidents and drunk driving and unprotected intercourse and doing the impulsive things like jumping off the bridge into the water at the Russian River because your friends are doing it. Oops, someone's going to break their neck. Well, hopefully it won't be me. All of these things are increased with psychiatric disturbances, particularly things like ADHD. Not anxiety. Anxiety is sometimes protective because kids get anxious about doing these things, but certainly ADHD. So we have to know that. Now, kids who take treatment for ADHD, largely stimulants like Ritalin and Adderall, actually have lower risks than kids who don't take treatment. So not lower than the general population, but lower than kids who don't get treatment. Likewise, the risk of a child engaging in substance abuse, if you have ADHD, is higher if you're unmedicated, lower if you're medicated for ADHD, even though it sounds like you're taking, amphetamine for your ADHD, which you are, but it works differently when you're taking it therapeutically. So we have to be thoughtful about that as well. The same general rules and guideposts apply, but those kids are at higher risk. ADHD in particular. Kids who are autistic, kids who are depressed, kids who are anxious, it's going to vary by what they're dealing with and who they are and how they approach that problem.
Okay, thank you. All right, Dr. Shatkin, any final parting words for our parents and educators and caregivers tonight?
No, it's been a pleasure being with you. If you want to talk more about these things, I'm on the radio an hour every week on Sirius XM, channel 110. Happy to talk with you. And yeah, and the book, I love the book. And it was really a great pleasure writing it. And it's been great fun to talk about it all over the country. And I really appreciate you inviting me back.
Well,
Hope it's
thank you
helpful.
so much, Dr. Jess Shatkin. This was an amazing evening. Really appreciate all the information. Thank you, everybody, for being with us. Hope to see you again soon. Good night, everybody.